How do women know if their hormones are declining? Hormones are the body's communicators, and throughout most of our life, they are the star self-starters. But then, suddenly, this might change. For women, hormone changes can happen quite suddenly, where we feel bothersome changes faster than we can figure out what might be happening. In fact, 80% of women have problems as hormone changes start to happen as we age. Symptoms can include irregular periods, hot or cold flashes, night sweats, mood swings, frozen shoulder, brain fog, sleep issues, joint pain, fatigue, heart palpitations, memory issues, digestive issues, increased belly fat, insulin resistance, weight gain, dry eyes, night vision issues, particularly with glare, anxiety, depression, headaches and migraines, dry skin, skin itchiness, tender breasts, metallic taste and smells, lack of sexual desire, vaginal dryness, loss of libido, something called not feeling myself syndrome, and others. These and more can occur during a life phase known as perimenopause, menopause, and postmenopause. The terms can be confusing. Best to start with the word menopause. Menopause is just one day in your life. It is the milestone of 12 full months without a menstrual period. The average age of menopause for women is 51. This means 12 months prior, a woman would be 50, which is on average the age when a woman may no longer have menstrual periods. Perimenopause is the phase leading up to menopause when hormones are fluctuating and generally declining. Perimenopause can begin as early as in the mid to late 30s and as late as late 40s to early 50s. In rare cases, women can be in perimenopause well into their 50s. Suffice to say, the age upon when hormones change can vary quite a lot. Back to the average. The average, though, is for perimenopause to begin in the early to mid-40s, for menopause to be at age 51, and postmenopause to be age 51 and beyond. Now that the definitions of terminology are defined, it's important to note, every woman is different. And if you are much younger or much older during these changes, you're still normal and shouldn't worry. What can you do? There are many things you can do to help ease this time of life, and at the same time prevent age-related diseases, including osteoporosis, urinary tract infections, and even diseases associated with older age, such as Alzheimer's, dementia, insulin resistance, among others. It should be noted it is a life transition phase, where a woman's body, and in particular a woman's brain, is undergoing a reconstruction period. The woman's body and brain are being refitted to leave their childbearing years behind and enter into a sage-like phase, a phase of wisdom and knowledge to pass on and for younger generations to prosper from. As the woman's body and brain undergo this transition, to ease with symptoms, hormone replacement therapy has proven hugely successful in not only easing symptoms but improving overall health outcomes. Bioidentical hormones are the current recommended hormone replacement option. Estrogen can be delivered through a patch which is adhered to the abdominal area. The patch delivered the most potent form of estrogen called estradiol, where the patches change out for a new patch twice a week. Progesterone can be easily delivered orally through a progesterone pill, generally taken at night, because it can help with more restful sleep, among other benefits. Last, testosterone is a little understood but highly beneficial hormone for women. Believe it or not, women in our 20s have 4 times more testosterone than estrogen in our bodies. It's a broadly held myth that women do not have or need testosterone. Women indeed have testosterone. And for women who might have issues with taking estrogen replacement, testosterone can be a viable alternative, delivering similar benefits to the brain and body. One of the challenges of accessing hormone replacement therapy, HRT for short, is finding a doctor who is trained in and knows how to prescribe HRT. Many online services can help. MIDI Health, Evernow, Alloy, by Winona are just a few within this fast-growing industry working to help women manage these transitioning years. Adequate exercise is always helpful, along with a Mediterranean diet, or similar with high protein and low sugar. Additionally, some women find intermittent fasting helpful, where you might skip breakfast and compress your eating window into eating only during 8 waking hours. Weight-bearing exercises at this time in life builds muscles which not only support bone health, but also hormone health and longevity. If this topic interests you, please comment below with questions, and future videos aim to address your thoughts. Here's to living to a healthy and happy 100.